is not just another website. It is a very unique community, customized and built to the needs of your brand, your compliance environment, your budget. It fits the bill exactly the way you need it to. It's, we've heard about some of these web advisory boards. Well, Medi-X-Change is nothing like that. If anything, Medi-X-Change is a fantastic supplement and support to that gap between when you actually have an opportunity to meet with your customers face-to-face and the next time that you see that customer face-to-face. There's this white space that happens in between. We think, we're touching all these customers, but really, in actual fact, I may actually only be connecting with a customer for a period of 1 or 2 hours over an advisory board meeting or a consultancy meeting. What Medi-X-Change allows me to do is to connect in a more regular fashion with these important customers and to have that dialogue ongoing between the time I last saw them at a live face-to-face meeting. Medi-X-Change has been really fundamental to helping support the engagement with our advisory boards before the meeting, during the meeting, and after the meeting. One of the key fundamentals that we've learned from this is it's not only a valuable tool to follow up in terms of an evaluation of the advisory board, but it facilitates an ongoing dialogue with your advisory board. So perhaps you have a project that the advisory board initiates through discussion and at the time of that meeting. Well, what Medi-X-Change offers is a forum, very strictly protected and secure, for your advisory board to continue working on things like publications, position papers, testing of your key messaging, helping you to dialogue all along the way before you connect with them at the next live advisory board meeting. In terms of our ability as a cross-functional lifecycle team, members of our medical department are working with our customers through Medi-X-Change. Members of our market research department are working with our customers through Medi-X-Change. Regulatory is able to pull and ask different questions with our customers. There is no limit to the use of Medi-X-Change from a cross-functional point of view. Is absolutely built around compliance with PIPEDA, with RxD, with any global organization rules that you may be governed by. There are many myriads of ways that you can set up the forums and the dialogues with your physicians that meet all of the necessary requirements to please the compliance piece of your business. Again, in an increasingly difficult time in the industry where budgets are shrinking and more and more resources are being taken away, I was actually very pleasantly surprised at just how cost-effective Medi-X-Change was at supporting my bottom line and my strategic principles. And as a brand that doesn't necessarily have 100% of your sales force focus, Medi-X-Change became one of the most cost-effective ways I could continue to ensure I was reaching out to customers in a way they were receptive to information regarding my brand. I became able to exchange with them in this portal in a way that I wasn't having to rely upon the sales force that may not be focused entirely on our brand. One of the aspects of working with IMPETUS is that they have all the thinking done for you. In consultation, when you sit down and you look at your strategic plans for the year, all of your strategies, all of your tactics are thought through from a digital environment. And what IMPETUS does is they enable you to integrate pieces of your tactical plan into a digital environment. That's not the work that I have to do all by myself. IMPETUS is there every step of the way, supporting me, guiding me, and ensuring that the follow-up is managed with these customers. I think historically, as we watch the online community grow, both from a professional and personal point of view, there may have been some reticence on the part of industry. But all of the evidence and the market research is out there to clearly substantiate that customers are now going online in droves. And so to shy away from that platform now, I think is a major missed opportunity for any brand. Well, it really begins to help you kind of come out of the box of the way you've always done things. And the more you really look at what online offerings and the way your customers are reaching out and engaging in new ways, the more you begin to think about the different types of formats and messages and opportunities you have to dialogue with them, and not just in a push manner, but in a push-pull, so it truly does become interactive and in a very timely fashion that the real-world implementation of face-to-face doesn't always necessitate as quickly. I cannot imagine in this environment, in the way that things are changing, not incorporating digital strategies into my brand planning. The world is changing, our customers are changing, and so by integrating Medi-X-Change into my brand planning, whether it's a small brand, a medium-sized brand, or a large brand, it would have to be one of the core strategies and tactics in any brand plan that I would be a part of.